If you're on Medicare, listen up. 3 costly mistakes are happening right now in 2026 that could cost you thousands of dollars, and most seniors have no idea they're making them. I'm talking about missing out on a brand new $2,000 prescription drug cap, losing valuable benefits you didn't know were disappearing, and missing critical deadlines that could lock you in to the wrong plan for an entire year. I'm breaking down all 3 mistakes in the next 5 minutes, and more importantly, I'll tell you exactly what to do to fix them before it's too late. So stick with me to the end. This could save you serious money. Mistake number 1. Not taking advantage of the new Medicare Part D out-of-pocket cap. Starting January 1st, 2025, yes, this just started. There's now a $2,000 maximum you'll pay out of pocket for prescription drugs each year. Here's what this means. Once you've spent $2,000 on your medications in a calendar year, Medicare covers 100% of your drug costs for the rest of that year. No more catastrophic coverage phase, no more donut hole confusion. But here's the mistake. A lot of seniors don't know about this yet, so they're not tracking their spending or planning strategically. If you're on expensive medications, you need to understand how this cap works. Here's what to do. First, track your prescription drug spending every month. Keep your receipts. Ask your pharmacist where you are toward that $2,000 cap. And if you have expensive medications, consider getting them filled earlier in the year so you hit that cap sooner and get free coverage for the rest of the year. This is a huge benefit that just started, and if you use it right, you could save thousands of dollars on your medications in 2026. Serious, concerned tone, delivering bad news with empathy. Mistake number 2. Not realizing you're about to lose valuable Medicare Advantage benefits. Here's what happened. The Medicare Advantage Value-Based Insurance Design Program, called VBID, officially ended on December 31st, 2025. What does that mean for you? If your Medicare Advantage plan offered things like a monthly credit for healthy foods, help with utility bills, or reduced copays for chronic conditions, those benefits might be gone in 2026. The government ended this program because it cost too much, but that doesn't help you if you were counting on that $50 grocery card every month or that help with your electric bill. A lot of seniors are finding out the hard way that benefits they had last year just disappeared. Here's what you need to do right now. Call the customer service number on the back of your Medicare Advantage card. Ask them directly, did my plan have VBID benefits, and did I lose them for 2026? Then review your Evidence of Coverage document. That's the booklet your plan sent you in the fall. And here's the good news. You still have time to switch plans. There's something called the Medicare Advantage Disenrollment Period from January 1st through February 14th, 2026. During this window, you can drop your Medicare Advantage plan and go back to original Medicare with a Part D drug plan or switch to a different Medicare Advantage plan. Mistake number 3. Confusing Medicare deadlines with marketplace deadlines. This one trips up so many people, and I get it, the government doesn't make this easy. Here's the deal. Medicare Annual Enrollment Period ran from October 15th through December 7th, 2025. That's over. But the health insurance marketplace, that's for people under 65 or those not on Medicare, that deadline is January 15th, 2026. The mistake? Honestly, seniors think they still have until January 15th to change their Medicare plan, but they don't. If you missed the December 7th deadline, you're generally stuck with your current Medicare plan for all of 2026. But, and this is important, there are exceptions. If you have both Medicare and Medicaid, you get a special enrollment period. If you moved to a new area, you can change plans. And like I mentioned, there's that Medicare Advantage Disenrollment Period from January 1st through February 14th. If you're not sure if you qualify for an exception, call Medicare directly at 1-800-MEDICARE. That's 1-800-633-4227. They can tell you if you have any options to change your coverage right now. And one more thing, be very careful about people calling you about Medicare changes. Medicare will never call you out of the blue trying to sell you a plan or asking for your Medicare number. If someone does that, it's a scam. Hang up and call Medicare directly at that 1-800 number. All right, those are the 3 big Medicare mistakes happening right now in 2026. But I know Medicare is confusing, and you probably have questions. Drop them in the comments below. I read every single one, and I'll answer your questions in my next video and give you a shout-out. And if you want that shout-out, make sure you leave your comment right now. Let's help each other navigate this Medicare maze together.